Good morning. Over the last number of years, we've seen a growing number of encampments established around our city. And now as the weather warms up, we're seeing them pop up under bridges and in parks and along trails and in ravines. We've seen heated debates over encampments, especially in places like Trinity Bellwoods, Allan Gardens, and Lamport Stadium Park. But the truth is, we have makeshift structures and tents set up in corners across our city, many of them out of sight. It is important to understand what's happening here and that we don't normalize the atrocious living conditions for our city's most vulnerable. It's unconscionable that we accept this as a solution for mental health, addiction, and homelessness. I was a police officer for 38 years in Toronto, and I understand how these encampments begin, but more than that, I understand the risks they pose both to the people that live in them and the residents that live around them. This is not a one-size-fits-all solution. We're dealing with mental health, we're dealing with addiction, we're dealing with economic hardship, we're dealing with PTSD, and we're dealing with trauma. When we're talking about encampments, we must start from a guiding principle that all citizens in Toronto deserve to live with dignity. We are normalizing encampments. Make no mistake, encampments are an outcome of a failed system. They pose a range of serious risks, including violence, overdose death, sexual violence, fire risks, and exposure to the elements, just to name a few. Many of the people that live in the encampments have a history of interaction with social services and the law, and have become distrustful of those very agencies trying to help them. A big part of our challenge will be to build trust between city agencies and the people we're trying to help. But make no mistake, encampments cannot be allowed to continue and must be removed while preserving the dignity to those people that live in the encampments. As mayor, I will first work on housing supply. We need to build more, we need to build fast. I announced a comprehensive housing plan that will focus on building day one, not just affordable housing, but deep affordable and supportive housing units. I'll develop wraparound service strategy to recognize a continuum of care between the city, Toronto Public Health, and a network of community service providers. I will introduce an accountable case management model to establish clear agency accountability for those seeking services and support. I'll increase the number of mobile crisis teams to provide round-the-clock response, provide free space in unused city-owned buildings for nonprofits who provide addiction treatment and want to expand their services. I'll call on the province to waive tuition for the next 3 years for students pursuing a certificate at a Toronto college as a mental health, addiction, or supportive housing worker, and for those pursuing certification in supportive housing management. I will hire additional public health nurses and negotiate builders of new rental buildings to include supportive units in their projects, which would provide to non-supports to operate their own programs. We can't abandon our most vulnerable to this kind of squalor and degradation. Thank you very much for coming, and I'll answer any questions now.